Hi everybody, welcome to my YouTube channel Dr. Sreenivas Medical Concepts and my FB page Dr. Sreenivas Concepts. This is Dr. Sreenivas, neurologist from Rajahmundry, Andhra Pradesh, India. My email is sreeklpm@gmail.com. I am also the medical author of the two books Focused Neurology and Exam Oriented Clinical Neurology. We are continuing with the neuroimaging concepts and spinal cord disorders. So today we'll be talking about the vascular disorders of the spinal cord. Neuroimaging concepts, part 36, spinal cord disorders, part 4, vascular disorders. So the vascular disorders of the spinal cord could be of two types. One, spinal cord infarction, second, hemorrhage. Amongst the spinal cord infarction, we have the disorder, spinal cord infarction associated with thoraco-abdominal aortic surgery. We all know that the radicular feeding arteries of spinal cord comes from the aorta, and therefore if there's a problem with the thoraco-abdominal aortic surgery, the feeding arteries or the radicular artery supplying the spinal cord can get affected and can result in spinal cord infarction. Same applies to the dissection. Systemic hypotension, if there's a lowered blood pressure, the blood flow to the spinal cord is compromised. Vasculopathy affecting the various vessels. Emboli, moving thrombus going and affecting the spinal cord. And finally the hypercoagulable states like protein C, protein S deficiency, homocystinuria or other hypercoagulable states. So these are the disorders which can cause spinal cord infarction. Thoraco-abdominal aortic surgery, dissection, systemic hypotension, vasculopathy, emboli and hypercoagulable state. Amongst the hemorrhage, we have two important disorders. One is the epidural hematoma, second is the arteriovenous malformation. So we have epidural hematoma and second is the arteriovenous malformation. So vascular disorders of spinal cord are basically two types. One, spinal cord infarction, second is hemorrhage. When we talk about the spinal cord infarction, the cervical spinal cord infarction, so here you can see this is the sagittal left and axial right T2 MRI of a man who has experienced a sudden onset of bilateral flaccid arm weakness. Note the abdominal T2 hypersensitivity restricted to the ventral spinal cord. So this is the ventral spinal cord, you can see here, and it is also seen in the ventral horns, both the ventral horns. In fact, there's an important sign which is used for this ventral horns of the spinal cord being affected due to infarction, known as owl's eye sign. When you see the owl, the eyes are prominent, both the eyes are prominent. So when the anterior horn cells, both the anterior horn cells get affected, they become prominent and is well seen in the neuroimaging like the eyes of the owl. That's why it's described as the owl's eye sign also. Second is the dural arteriovenous fistula. So arteriovenous fistula, it's an abnormal communication between the artery and the veins. If it is seen in the dura mater, we call it as a dura arteriovenous fistula. So here you can see the nice dura arteriovenous fistula. So dural arteriovenous fistula of the cord is the sagittal T2 weighted MRI image of the lower spinal cord with progressive myelopathy. You can see the T2 hyperintensity at the conus medullaris and multiple vascular flow voids surrounding the spinal cord and extending up to the mid-thoracic vertebral levels, resulting in the arteriovenous fistula. So this is it, very characteristic. And when angiographic injection is given to this patient, it shows an abnormal early filling of draining veins surround the spinal cord, confirming the presence of an arteriovenous fistula. The fistula is repaired and the patient's symptoms improved. But very characteristic is the abnormal early filling of the draining veins. Abnormal early filling of the draining veins. Why is there abnormal early filling of draining veins. Generally, when we give a contrast, it enters the artery, from artery to the arterioles, capillaries, venules and veins. So it takes some time for the contrast to appear from the artery and into the vein. But in arteriovenous fistula, there is a direct communication between the artery and the vein. So there is no intervening arterioles, capillaries or venules. So there is a direct communication between the artery and the vein, and therefore when we give a contrast or a dye, from artery it appears immediately into the vein. So early filling or early dilatation of the veins is very characteristic neuroimaging finding. This is what is described in the arteriovenous fistula, abnormal early filling of the draining veins. Why early filling? Because it enters directly from the artery to the veins. There is no intervening arterioles, capillaries, venules or veins. So it appears early. So early filling of the draining veins is very characteristic of AV fistula. And the other important concepts of clinical neurology, I put it in an exam, in a book called Exam Oriented Clinical Neurology, which will be very useful for students appearing for the clinical neurology exam. So if you're interested, this book could be purchased. The other book I've written is Focused Neurology, all the important theoretical points of neurology. I put it in a question answer format in the book Focused Neurology. So this book will be very useful for students appearing for the Viva or oral exams. This book is available online from all leading booksellers including Amazon. So if interested, this book could be purchased online. I hope you have enjoyed listening to these wonderful concepts of spinal cord disorders, the vascular disorders. If you have enjoyed, please like and share the link, but please subscribe to my YouTube channel, Dr. Sreenivas Medical Concept, which is India's leading neurology educational YouTube channel, and my FB page, Dr. Sreenivas Concepts. Thank you. Bye.